Welcome back, students. I'm so glad you voluntarily came to class today and that you are voluntarily getting this education. You understand how much it helps you in planning the rest of your life. As you can see, I'm the gynecologic surgeon who has volunteered to give you this education. That's why I'm wearing a volunteer t-shirt with a surgeon's cap and mask. And I volunteered to do so because it gives me great joy to know that you'll have peace of mind in making the best decisions for managing your menopause your way. This is video number 406, and believe it or not, we've been pursuing this unit on breast cancer for 1 week shy of a full year. That's right. This is the 51st breast cancer video. But when it comes to all the attention directed toward breast cancer in other aspects of your life, I just had to ensure that I gave you all the facts. So we have been discussing all your management options for preventing breast cancer. Last week, I presented the medication options for doing so, and you learned that all but one of them consists of actual chemotherapy agents for the treatment of breast cancer. But the medication options are only suitable for women at very high risk of breast cancer, for whom the benefits of those medications outweigh the risks of those medications. If you are at very high risk for breast cancer and you take them for a period of years, they can decrease your risk of ever getting breast cancer. Well, today's topic is along those same lines. The big difference is that instead of using medications to decrease your risk of breast cancer, you can have voluntary surgery to decrease your risk of breast cancer. And I will explain what kinds of surgery that can entail. As this is a topic that is particular to only certain women, and because it's impossible to include as much in my book as I can here in these videos, you will not find this material in the chapter on breast cancer in my book. You have to voluntarily get it here on YouTube. So last week, you learned that utilizing mostly chemotherapeutic agents to prevent rather than treat breast cancer is reserved for situations in which your risk for breast cancer is very, very high. This is also true for the voluntary preventive surgical options that we'll discuss today. These voluntary surgical procedures are not reasonable for women with the average risk of breast cancer of 1 in 7. And that's because, just as in the last video, the benefits do not outweigh the risks unless your risk for breast cancer is very, very high in the first place. The surgeries we'll be discussing today fall into two broad categories: breast surgeries and ovarian surgeries. And the reason there are preventive surgeries involving either or both your breasts and your ovaries is because breast cancer and ovarian cancer, by and large, have many of the same risk factors. I'll be teaching you all about ovarian cancer in the next big unit. For now, just know that they can be related. So let's discuss the various surgical procedures that can decrease your risk or prevent breast cancer. And we'll separate the breast surgeries from the ovarian surgeries, and we'll start with the breast surgeries. The voluntary breast surgeries include 3 possible procedures. Together they constitute risk-reducing mastectomies. Risk-reducing mastectomy is voluntary surgical removal of your breasts in the absence of breast cancer in an effort to decrease your risk of ever getting breast cancer. In other words, risk-reducing mastectomy is prophylactic mastectomy. Since breast cancer can be either primary or recurrent, there are different terms for whether you undergo voluntary risk-reducing mastectomy to prevent a first or primary breast cancer or to prevent a second or recurrent breast cancer. If your goal is to prevent a primary breast cancer and you have no previous personal history of breast cancer, the procedure is called a bilateral risk-reducing mastectomy. Bilateral risk-reducing mastectomy entails removing both breasts before ever getting breast cancer in order to decrease your risk of ever getting breast cancer. On the other hand, if your goal is to prevent a recurrence of breast cancer that you've already had in one breast, the procedure is called a contralateral risk-reducing mastectomy. The word contralateral means the other side or opposite side. So contralateral risk-reducing mastectomy entails removing your unaffected normal breast when having a mastectomy performed for management of breast cancer in the opposite breast. So instead of removing only the one breast with breast cancer, you remove them both. The objective with all voluntary risk-reducing mastectomies is to prevent a future breast cancer. So, how much can you benefit by having a risk-reducing mastectomy? Well, the most important thing for you to know is that nothing can completely eliminate the possibility of breast cancer. That's why these procedures are called risk-reducing rather than risk-eliminating. Additionally, you have to distinguish between relative risk and absolute risk. I taught you about relative risk versus absolute risk in video number 366. In the case of prophylactic risk-reducing mastectomy, relative risk is the difference in risk of breast cancer for women with the surgery versus women without the surgery. So relative risk isn't about you personally. It pertains to the population of women, the whole population of women. But the problem with this is that different women have different levels of risk to begin with. And relative risk does not take those differences into account. So you end up lumping together many different degrees of risk, which makes the group heterogeneous. When it comes to considering a voluntary risk-reducing mastectomy, you want to know how much it will decrease your risk personally. That's called absolute risk. In the case of prophylactic risk-reducing mastectomy, absolute risk is the difference in your risk for breast cancer with the surgery versus without the surgery. So absolute risk tells you how much the surgery will decrease your personal risk. And the statistic for that is 65%. This means that if you voluntarily undergo a risk-reducing mastectomy, you will decrease your risk of future breast cancer by 65%. Given the fact that this is voluntary risk-reducing surgery, and that all women do not have the same degree of risk or want the same procedure, there are different types of risk-reducing mastectomy. Most are performed along with reconstructive breast surgery. There are 3 options for voluntary risk-reducing mastectomy: simple or total mastectomy, skin-sparing mastectomy, and nipple-sparing mastectomy. A simple mastectomy, also called a total mastectomy, entails removal of all your breast tissue, all the skin overlying your breast, and your nipples. A skin-sparing mastectomy entails removal of all your breast tissue and your nipples. It preserves most of your overlying skin. A nipple-sparing mastectomy entails removal of all your breast tissue only. Both the overlying skin and your nipples are spared. Nipple-sparing mastectomy results in the best cosmetic outcome with no significant increase in your breast cancer risk if you are having it to prevent primary breast cancer. There's only a 3% risk of getting breast cancer in the remaining skin or nipple. Now, even though these are called risk-reducing surgeries, they still have risks of their own. All surgery has risks. So when having a voluntary surgical procedure, you incur the risks of the surgery itself. All surgical procedures have the risk of bleeding, infection, and damage to nearby anatomy, regardless of your personal degree of risk for surgery. In addition to those general risks, you have to add any personal risks that you may have. These are things like obesity, a restricted airway, smoking, a blood clotting disorder, any medical problem that makes surgery or anesthesia risky. With these mastectomies, there is a 10 to 20% risk of skin or nipple necrosis. The word necrosis means death of tissue. And necrosis occurs when the blood supply to a body part is inadequate. This means that because much of the blood supply to the skin and nipple is obliterated during removal of all your breast tissue, there is a 10 to 20% chance that there won't be enough blood supply to the skin and nipple. So this possible risk of the surgery itself is an important consideration in choosing the kind of risk-reducing surgery you prefer. And that about does it for risk-reducing mastectomies. So what you have to do is you have to put all these benefits and risks on the scale. You just add all the benefits, all the risks, and you only do this if the benefits outweigh the risks. You just pile all of them on the scale. Whichever one weighs more, that's the key. Always do whatever offers more benefit and less risk. So, what about surgical procedures pertaining to your ovaries? Because breast cancer and ovarian cancer share many of the same risk factors. So the things that can decrease your risk for one tend to also decrease your risk for the other. So another surgical option for decreasing your risk of breast cancer is to have your ovaries removed. Ages ago, I taught you the surgical terms for removing your ovaries. Unilateral oophorectomy means removal of just one ovary. Right unilateral oophorectomy is removal of your right ovary only. Left unilateral oophorectomy is removal of your left ovary only. Bilateral oophorectomy means removal of both ovaries. So the prophylactic procedure for reducing your risk of breast cancer is called a prophylactic bilateral oophorectomy. Prophylactic bilateral oophorectomy entails removal of both ovaries with the goal of decreasing your risk of both breast cancer and ovarian cancer. To benefit, both ovaries must be removed. If you keep one and remove the other, you do not change your risk for breast or ovarian cancer at all. But if you have both ovaries removed, it decreases your risk of breast cancer by 50%. And it decreases your risk of ovarian cancer by 90%. Because it is surgery, bilateral oophorectomy also has the risks of bleeding, infection, and damage to nearby anatomy. But the most significant byproduct of bilateral oophorectomy is that if you're not already postmenopausal, it results in immediate postmenopause. Of course, this is going to happen to every woman eventually anyway. But depending on your age when you have the procedure, it could result in premature postmenopause. And with postmenopause comes the need to manage your menopause using all the information you've learned here at Menopause University. If you pursued risk-reducing surgery after already having breast cancer, the cancer may have affected your options for your menopause management. If you pursued risk-reducing surgery before ever having breast cancer, it does not affect your options for your menopause management at all. This is the stuff that is unique for every situation, and it's highly personal. The bottom line is that how you manage your menopause may or may not be affected by the fact that you had a high risk of breast cancer before your risk-reducing surgery. I'll be discussing menopause management after breast cancer itself in the very next video. So once again, you have to put all these things on the scale. You just start piling everything on the scale, and you only do whatever is most beneficial and least risky. Do the one that weighs more. That's the key to success. Many women choose to have voluntary prophylactic surgery on both their breasts and their ovaries. In that case, the degree of risk reduction increases even more. For instance, if prophylactic risk-reducing simple mastectomy decreases your risk of breast cancer by 65%, and prophylactic bilateral oophorectomy decreases your risk of breast cancer by 50%, taken together, you decrease your risk of breast cancer by 90%. But notice that you still have a small chance of getting breast cancer. Nothing can decrease your risk to zero. And each surgical procedure carries all the risks of that particular surgical procedure, which means that you have that much more to pile on the scale and weigh in terms of benefit versus risk. So you just pile all the benefits on one side and all the risks on the other side and see which one weighs more. Everything boils down to benefit versus risk. You can't go wrong if you always do what offers the most benefit and the least risk. All right, here's a chart delineating these procedures and their degree of risk reduction. It summarizes our lesson today. This simple chart just divides the voluntary prophylactic surgical procedures into breast procedures, ovarian procedures, and both breast and ovarian procedures in the first column. Breast procedures are in pink tones. Ovarian procedures are in purple tones, and both breast and ovarian procedures are in blue tones. The second column lists the 5 voluntary surgical options for preventing breast cancer. Simple or total mastectomy, skin-sparing mastectomy, nipple-sparing mastectomy, bilateral oophorectomy, and mastectomy with bilateral oophorectomy. Across the top row, I've listed all the factors of consideration, including name of the surgical procedure, anatomy removed, anatomy spared, your absolute risk reduction, complications, and consequences. Then I've designated the particulars for each factor in the body of the chart. If you want this chart, you can get it by clicking the link in the description box just below this screen, or you can go to menopausetailor.me. The summary for today is this. If you have a very high risk of breast cancer, you have the option of voluntarily pursuing risk-reducing surgical procedures involving removal of your breast and or ovarian tissue to significantly decrease your risk of breast cancer. So that does it for the surgical options for preventing breast cancer. And that does it for all the management options for preventing breast cancer. Next week, I'll discuss menopause management after having breast cancer. We are almost finished with this unit. Be sure to voluntarily go to menopausetailor.me to voluntarily schedule a consultation that will change your life and reduce your risks for all the things you want to avoid. Volunteer to subscribe to my newsletter and this channel. Voluntarily visit Facebook, Instagram, Pinterest, and Stories to see all the goings on there. And I hope you volunteer to come back next week. Until then, bye.